morning, everyone. This is Kim Ludwig. Just be another 20 minutes or so, and we will get started with today's presentation. So in the meantime, just feel free to use the chat box if you have any questions or want to introduce yourself. I'm just going to pull up a slide here just with a few housekeeping items. So until then, just be patient and we'll get started in about 20 minutes.
Sounds great.
Is everyone able to see the slide okay?
Vicki, you're going to need to make Kim, me, and Tracy co-hosts. Oh, wait, I'm already a co-host, but you'll need to make Kim and Tracy co-hosts. Oh, there you go, Kim. Now it's up.
Oh, do I need to do anything now?
Yes. So go over Kim's picture and hit the three dots.
Okay.
And make her a co-host.
Okay.
And then make Tracy one as well.
All right, there we got it. Make a co-host, okay. And then I need to make Tracy a co-host.
Yep.
Okay. Anybody else?
I don't think so.
Okay. Yeah, let me know if there's anything else. I'll be putting up the RCC in about 5 minutes and then do it again and again. So, okay. Do you want to? Yes. Okay. Thanks.
It doesn't look like Kim got made one.
There it is. Yep.
Are you able to view my screen though? Okay,
yep,
perfect.
I can see it all now.
Sounds good. And Tracy, when we get to the start of the presentation, I'll just go ahead and introduce you along with do some opening comments, and then feel free to, if you want to add more comments. In the meantime, we'll just pull up your presentation and just let me know when to move to the next slide or so forth. So
That sounds great, Kim. Thank you.
Good morning, everyone. For those that are just joining, just doing a quick sound check to make sure you're able to hear me okay. We will get started with the presentation in about 11 minutes. So in the meantime, just be patient. Feel free to use the chat box if you have any questions, want to make a comment, or even just introduce yourself. So Hi again, it's Kim Ludwig again. Just letting you know that we are about 5 minutes away from the presentation. If you require real-time closed captioning, that is available as a feature for you. There is a link that is available in the chat box, so please feel free to access that if necessary. Again, we will get started in 5 minutes.
Should be a control.
Right. Well, it is time to get started again. Good morning, everyone, and welcome to today's training on remote work, accommodations, and COVID. My name is Kim Ludwig again, and I will be your moderator for today's training. Today's training is being held in recognition of National Disability Employment Awareness Month, in which is celebrated every year throughout the month of October, recognizing the contributions of workers with disabilities and providing education about the benefits of their skills and talents they bring to workplaces. Ensuring that America's workplaces continue to include and accommodate people with disabilities will be an important part of our economic rebound. And now more than ever, flexibility is important for both workers and employers, in which resonates with this year's theme, increasing access and opportunity. In observation of this, Governor Nome has proclaimed the month of October as Disability Employment Awareness Month in South Dakota. Now I'd like to recognize and express appreciation to the planning committees from Sioux Falls, Rapid City, Yankton, and Mitchell that were instrumental in making today's presentation possible. Members of the planning committees consist of Vocational Rehabilitation, the Sioux Falls Business Resource Network, the Workforce Diversity Network of the Black Hills, Human Resource Chapters throughout the state, Chamber of Commerce, Community Support Providers, Mayor Advisory Committees for People with Disabilities, and more. I am pleased to introduce today's speaker, Tracy DeFreitas. She is a lead consultant and ADA specialist for the Job Accommodation Network, or JAN, in which is a leading national source of expert guidance on workplace accommodations and disability employment issues. With more than 25 years of experience in the disability employment field, Tracy is one of JAN's senior consultants. She is also an experienced national speaker and published author who specializes in ADA Title I compliance, the interactive accommodation process, and workplace flexibility. Before I hand it over to Tracy, I have a few housekeeping items to cover. First, today's presentation has availability of closed captioning, and see the chat box for the link to access it. Also, the presentation is being recorded. For those of you who need CRC, CESP, SHRM, and/or HRCI credit, or a certificate of attendance, there will be a link available in the chat box following the presentation for you to complete a form to show you've participated. An evaluation survey will also be available for today's evaluation, which the link will also be made available in the chat box following the presentation. Next, we'd love to hear from you during the presentation. If you have a question for our presenter, please use the chat box feature that is, again, located on your control panel. Also, if you encounter any technical difficulties or would like to send a chat directly to someone, please use the chat box. We will also be answering questions at the end of the session. If we don't get to your question during the webinar, we will be sure to follow up afterward. So without further ado, I'd like to welcome our presenter. Tracy, over to you.
Thank you so much, Kim, and thank you also, Vicki Stewart, and the rest of the planning committee for inviting Jan to provide this training for everyone today. I'm glad to be here. So we'll go ahead and get started, and I'm going to talk just real quickly about the Jan service so that you're aware of who we are and why we're talking with you today. JAN's a free national service that provides a consultation regarding the Americans with Disabilities Act, the Title I provisions of the law, and reasonable accommodations in the workplace. Kim, oh, there we go. Here come the slides. Thank you so much. All right, so on the JAN slide, the first JAN slide about JAN, we're located in Morgantown, West Virginia. At West Virginia University, actually, but we're funded by a contract with the Office of Disability Employment Policy through the U.S. Department of Labor. Some of you are probably familiar with ODEP, and I've noticed that you do have the NDEAM poster up that ODEP does provide, so that's great. We're a free service that was established in 1983. And we do provide expert consultation on job accommodation solutions for all types of industries, job categories, and for all impairments. We also provide targeted technical assistance on the Title I provisions of the ADA, also on the Rehab Act Section 501, which applies to the federal government. So we're a resource related to that type of legislation in the workplace. If you could go to slide 4, Kim. So if you'd like to learn more about our service, we are going to direct you to askjan.org, so you can go ahead and see some information related to how to get in touch with us. We have a great number of resources on that site. Remember, it's a free service. So if you are in a situation where you're looking for accommodation ideas or technical assistance on the ADA, you can look to us as that resource. We're there for individuals with disabilities, employers who have questions, rehab professionals who have questions. So certainly take advantage of that service. We have a great deal of training, an ADA library, and tons of publications and resources related to all sorts of disability employment related issues. So go to askjan.org for more information. At the end of the PowerPoint, there's also some contact information. So once that goes out to everyone, you'll be able to access it there too. All right, next slide. So today we're going to start off with a little bit of ADA basics to kind of set up the foundation for providing accommodations in the workplace. And then we'll get into talking about some COVID-19 complexities and remote work accommodations and other types of accommodations around this COVID-19 pandemic. It's something that's on everyone's mind right now. So it's something that, we're getting a lot of questions about and have lots of information to offer you. So starting with ADA Basics, Title I. So Title I is the title of the ADA that applies in employment. Of course, the ADA is a federal civil rights statute that removes barriers to equal employment for individuals with disabilities. Some of you are probably familiar with the ADA Amendments Act. The ADA was amended back in 2008 in order to essentially expand the definition of disability. It didn't change the definition, but it expanded how we analyze that definition so that it applies to more individuals in the work environment. The ADA applies to covered entities, so private sector employers with 15 or more employees and state and local government employers as well. And of course, it prohibits disability-based discrimination in all employment practices and during all stages of the employment process, so from hiring to retiring. It also requires reasonable accommodation when the person's disability is known and of course, barring undue hardship. And we'll talk more about this as I proceed. Next slide. So just a few important facts about reasonable accommodation to keep in mind as I'm talking today. There's no comprehensive list of reasonable accommodations under the ADA. So you're always looking at considering accommodations on a case-by-case basis. Also, the employer technically decides what's considered to be reasonable. And they do have the right to choose among effective, reasonable accommodation solutions. So it's up to them to decide what's plausible, what's possible in the work environment. Of course, the preference of the individual with the disability should be given primary consideration when it is reasonable, and that is what's suggested by the Equal Employment Opportunity Commission, which is the agency that enforces the ADA. There's no requirement to remove essential functions or to provide personal use items, to lower production standards, or to create new jobs as reasonable accommodation. So these are just some real simple facts to keep in mind related to providing reasonable accommodation in the work environment. Next slide. Now let's talk about inviting employees to request flexibilities. And the reason that I kind of approach this session this way is because, of course, COVID-19 is on everyone's mind right now. Employers are trying to get people back into the work environment to do it in a safe way. And so a lot of employers are wondering how to go about inviting employees to request flexibilities. There are ways for an employer to do this. You have to be careful, of course, because remember that employers cannot ask individuals, employees, if they will need accommodations in order to perform job duties. So you have to be careful how you go about asking people to request accommodations, basically. There are ways to do that in this pandemic situation that employers can keep in mind. So it's about, of course, inviting people to request flexibilities. The EEOC offers a technical assistance guidance that's extremely useful right now. What you should know about COVID-19 and the ADA, the Rehab Act, and other EEO laws. And I'm going to reference this quite a bit. But the question G6 kind of gives employers some other ideas for thinking about ways to invite people to know when or how to request accommodations in this situation. One thing to do is, of course, to make information available to all employees. So you're not just picking out people with disabilities or people that you know might have a medical condition that puts them at higher risk for complications or severe illness from COVID-19. But if you make everyone aware that they have an opportunity to request flexibilities, that's a better approach. Of course, the employers could note the willingness to consider requests for accommodation or flexibilities on an individualized basis. So whenever an employer is asking people to or inviting people to request changes in the work environment, they're going to do that on a case-by-case basis if someone requests those flexibilities. You're going to look at, are they asking for something that everyone is entitled to based on a benefit of employment? Or is it something that they're requesting to on the basis of a need for accommodation that might be consistent with federal employment non-discrimination laws like the ADA, for example? So you're going to do that case by case. When someone presents the request for flexibility, you're going to take a look at the situation and decide, can you provide that flexibility without considering the laws that come into play? Is it just something you're going to offer to employees? Or do you have to kind of go down that road of engaging in the interactive process under the Americans with Disabilities Act to decide if someone has a disability and if they're entitled to reasonable accommodation on that basis? So on the next slide, that interactive process is something that it can be a formal process, it can be an informal process, but it is something that we do in order to provide accommodations under the ADA. There's no standard process. Jan offers a 6-step process that employers can certainly use or customize to meet their own needs. Many employers have their own policies and procedures for engaging in this process, but it's something you're simply going to do to explore accommodations. So you're going to try to figure out, does someone have the right to go ahead and receive accommodation in the workplace? You're going to gather information to figure that out. And then you're going to explore and choose among accommodations that are reasonable and effective in order to ultimately enable that person to perform the essential duties of the job or to access a benefit or privilege of employment where there may be some limitations on the basis of disability. Next slide. Now, of course, we're thinking about COVID-19 and we're wondering, what's the difference in this situation now? Are there changes in engaging in the interactive process under the ADA because of the COVID-19 pandemic? And the bottom line is that the ADA or the Rehab Act, it's not different. The interactive process is not different necessarily because of the pandemic situation. There's not a need to change any procedure or practice or forms that you might have in order to engage in this process and decide whether to provide accommodations under the ADA related to COVID-19. So you're going to follow your standard procedures for the most part. What is new is there's some updated EEOC guidance and technical assistance that can be very useful in deciding how to engage in this process. The first I mentioned already is that what you should know document, which is an excellent resource that has been updated since the pandemic hit back in March. EEOC has gone back and made updates to this guidance based on evolving situations around COVID-19 and guidance from public health authorities, because as that guidance from public health authorities changes, this might also change how we address COVID-19 in the work environment. So sometimes those updates need to be made. Another document, Pandemic Preparedness in the Workplace in the ADA, another good resource. It was actually around back when H1N1 was an issue. They've updated it a bit to consider it and use it during the COVID-19 pandemic as well. So another good resource for you to access if you need to do that. Any resource that I'm mentioning is included at the end on the slide, so you'll have access to those links as well. Next slide. Something else to consider is that there might be new strategies for engaging in the interactive process. So for example, adjustments are being made for many employees, not just those with disabilities. So you want to keep in mind is what sort of changes or flexibilities are we implementing for everyone in order to manage this situation. So you want to consider that. Also, you might need to engage in alternative approaches for obtaining and storing disability-related information. It might be difficult for individuals to access disability-related documentation for ADA purposes because it might be difficult to get to a healthcare provider. Also, the EEOC perspective regarding certain types of accommodations might be a little bit different right now. So we have pre-pandemic guidance on some things like telework, for example, and now current pandemic guidance from EEOC that's a little bit different. And I'll talk about that when I get to the remote work accommodations. Also, accommodation duration might have an end date, so it's not uncommon for employers to consider putting an end date on an accommodation that's provided right now because, again, the situation is evolving and things might change. And it might be that an accommodation that was provided a month ago might start to become something that is not reasonable any longer because we just don't know when this pandemic is going to end. Finally, accommodation issues do seem to center right now around working safely, telework, flexibility, and leave. So those seem to be the primary issues that we're hearing about right now. Next slide. So as you're thinking about engaging in the interactive process, I'd encourage you to think about these tips. So know the 5 W's and the H. What's being requested and why? Who's requesting accommodation? So is it you're having to figure out, is it someone who has a disability or is it someone who's requesting accommodation for a family member related reason? Is it somebody who's trying to avoid exposure because they don't want to bring it home to that family member? Is it somebody who is in the high age, in the age risk group, not necessarily having a disability? So you want to think about who's requesting accommodation. When will the accommodation begin and end? Again, this is the case of knowing, is it something that we're going to put an end date on? Is it something we're going to leave as indefinite? So you'll have to keep that in mind. Where is the accommodation needed? A lot of people are working remotely right now. So is it an accommodation that's needed outside of the traditional work environment, or is it something that's needed in the work environment? And then finally, the how. So how will the accommodation solve the issue of performing the essential duties of the job or meeting the standards in this pandemic situation? So these are just some real simple things to think about as you're engaging in that interactive process. Next slide. So when we're thinking about recognizing a request for accommodation, you want to be thinking about what's being requested and why. So is an applicant or an employee asking for an adjustment or a change at work for a reason related to a medical impairment? That's what's going to help you realize that it's an accommodation request on the basis of a disability. And it could be something that you might need to provide under the ADA if it's reasonable. Some commonly requested COVID-19 related adjustments and changes that we're hearing about, of course, are telework, equipment that might be needed for telework, job restructuring where you're changing when or how certain functions are performed, personal protective equipment, policy modifications like when or where and how work is performed, schedule modifications that might be necessary maybe to help with lessening the number of people in the work environment or how somebody commutes to work. And then of course, leave is also something that's coming up a lot right now as well. Next slide. Now, when you're considering, when you're recognizing a request for accommodation, one of the first things that you want to think about is, is somebody requesting something that really is an accommodation request? So keep in mind something we call it, Jan, we kind of dubbed it the hoops theory, is the idea that it's not an accommodation request when someone's requesting access to the same thing or same benefits or privileges available to similarly situated employees. So consider, are all or most employees working from home? Have schedules been modified for others? Has ergonomic equipment been provided to work at home for other people? So when somebody is requesting, someone with a disability who happens to have a disability is requesting something as what you might think is an accommodation, you want to analyze whether or not it's something that anyone has access to. And if it is, then it's not something that you would engage in the interactive process for and provide as a reasonable accommodation, because that person has access, should have access to that on the same basis that anyone else would. So you don't treat those who request modifications for a disability related reason differently than others who request the same modifications. Now, if somebody is requesting something that goes beyond, now it does become a request for accommodation. So an example of that might be if you're allowing employees to telework 3 days a week, but an employee with a disability is requesting 5 days a week due to a disability related reason. Now that's a request for accommodation, and you get to determine at that point if the person's entitled to the accommodation and if it's reasonable to go ahead and provide it. So keep that hoops theory in mind. Next slide. Now, as you are recognizing an accommodation request and engaging in that interactive process, one of the most important things you're going to do is gather information. So how can it be determined that an individual qualifies to receive reasonable accommodation? We have to determine if that individual has or has a record of having had a disability under the ADA. So you're going to follow those disability-related inquiry rules under the law. You have to have a reason that's job-related and consistent with business necessity to ask questions about the disability. And that's generally going to be when somebody requests an accommodation and the impairment and the need for accommodation are not known or obvious. And you're going to gather some details about who has the impairment, what the limitations are, how they impact performance on job duties, and what accommodation solutions are being proposed. So you're going to go through that process. Next slide. The first thing you're going to figure out is, does the individual have a disability under the ADA? So consider what disability-related information is already known about the impairment for which the accommodation is being requested. If the impairment is obvious and the need for accommodation is obvious, you don't need a lot of information to proceed in that interactive process. On the other hand, if it's not obvious or already known, then the employer may ask questions or request medical documentation to determine whether the person has a disability as defined by the ADA. And that's what's going to lead to determining your next steps. Next slide. Now, if somebody is requesting an accommodation, it can be for a lot of reasons related to COVID-19. A lot of what we're hearing about are workers with certain underlying medical conditions. So those who are or might be at increased risk for severe illness from COVID-19. And this is on the basis of information that's provided by the Centers for Disease Control and Prevention. They do update this information. I think the last update was earlier in September. But basically, they've identified certain impairments that would make somebody at increased risk or might put them at increased risk for severe illness from COVID-19. Those individuals who might have an impairment like that, you're going to consider them to be a person with a disability, and you're going to look at whether or not you can provide reasonable accommodations. These are just examples. I do encourage you to go to the CDC site for more details, but examples of those with serious heart conditions, those who might have a compromised immune system, cancer, chronic kidney disease, liver disease. So these are just some examples. Next slide. Also, who's requesting accommodation? Workers with disabilities who were previously accommodated in the workplace and are now working remotely, who may need an accommodation that they had in the work environment but are now forced to work at home. Are those who have impairments that might be exacerbated by circumstances related to COVID-19. So for example, someone with a mental health impairment where there might be severe anxiety or depression or other issues that might be affecting them because of the COVID-19 pandemic. So we want to keep those things in mind. And EEOC does address some of those issues within their the what you should know guidance and the pandemic preparedness guidance as well. And I've tried to pull out those specific questions so you can get directly to them when you follow up. Next slide. Now, another thing that you want to know is, actually, let me step back just a second. When we're thinking about who's requesting accommodation, as I mentioned, there can be other people who are requesting accommodations. So individuals who might be in the higher age, the age risk group, individuals who might be pregnant, individuals who have family members at home who might be at risk. So you really have to analyze those things to figure out, is it an ADA issue? Is it something that might fall under the Pregnancy Discrimination Act? Is it something where you need to keep the Age Discrimination in Employment Act in mind? Although it doesn't require accommodation, it does require that you treat people who might fall into the age group similarly to others. So you do want to analyze that situation and figure out who is requesting the accommodation. Now, when you're exploring accommodations, of course, you want to think about, where is the accommodation needed? You have to understand where the job-related barrier exists. So is it at home or another location that the person might be working in? Is it at the workplace or another location? Is it during the commute? So these are sort of places where the accommodation issue might crop up. And how will the accommodation solve the issue? Remember, at the end of the day, it's all about whether or not that person can perform the essential duties of the job with or without accommodation. So in the context of COVID-19, it's about whether or not that person can work safely and perform their job duties in a way, in a different way, perhaps, in response to the pandemic situation. So always at the end of the day, can the person perform the essential job duties with or without accommodation in order to remain qualified? Next slide. When you're exploring accommodations, again, I'm coming back to that idea of the, when will the accommodation begin and end? So you might need to adapt that interactive process to suit some changing circumstances based on public health directives, current trends related to returning to work and telework and leave. So, we have a lot of people who were sent home, and now as businesses are reopening, they're setting dates for people to return to work. And so the accommodation might start when that return to work date happens. There might be an end date on it because it might only be feasible to allow somebody to be accommodated for a certain period of time. This is probably, I would say, mostly coming up in situations where somebody maybe is saying they still cannot come into the work environment, and maybe they cannot work from home, and maybe it's a leave situation. And that's where it can be real tricky because we're looking at a very indefinite situation. But an employer might be able to say, well, we can do this for another month and see where things go in terms of the evolution of the pandemic and what we need to be aware of. Again, you can turn to that what you should know guidance for some information related to placing an end date on an accommodation. That would help. The other thing you can do is provide accommodations temporarily or on a trial basis, and Jan does provide some resources to help you do that or to document that. So I think that's something really important to consider during this time, is that just because you agree to provide an accommodation doesn't mean you're agreeing to provide it forever or indefinitely. You can put timeframes on that, and you can indicate that it's temporary for right now. Next slide. Of course, always keep in mind when you're thinking about accommodations that there's no requirement to remove essential job functions or lower your standards in terms of getting the work done or creating a new job. While these things are not required under the ADA, it's certainly something you can do, and a lot of employers are. So I will say that, in some situations where people were sent home sort of as a reaction to the onset of the pandemic, sometimes certain duties were changed or taken away in order to enable that to happen. So it is possible to make those kinds of changes. There's just no legal obligation to do that. EEOC does make it clear in their what you should know guidance that the fact that an employer temporarily excused performance of one or more essential functions for the purpose of protecting employees and in response to COVID-19 doesn't mean that the employer permanently changed a job's essential function. So just because it is happening now or has happened doesn't mean that that job is changed forever. But that's also a good reason why it's important to document. So if you're going to make changes like this temporarily, document that it is only in response to the current pandemic and for the current time. Next slide. When you're exploring accommodations, of course, you want to take advantage of free resources like the Jan service. So we have a lot of information on our website at askjan.org, which you can access freely. You can also contact us for information. Pre-pandemic, we took calls every day, all day long. Right now, we're operating a little bit more in an electronic format. We have a live real-time chat that you can access all day long. You can send in emails. You can also still call our service and leave a message for someone to call you back. So you still have access to us in lots of different ways. But visit that site for more information, askjan.org. Next slide. I should also note that we do have a coronavirus COVID a page right off of our homepage. So if you're looking for detailed information specific to this topic, go right there and you'll find a lot of information that you need, including the guidances that I'm referring to right now. So after you've explored accommodations, you have to choose those accommodations. So choosing and determining what is reasonable is something that takes a little bit of time. We know that employers may choose among effective, reasonable accommodation solutions. What does that mean? Well, it means that it's effective for the purpose. It enables the person to perform the essential job duties or to meet standards or to access a benefit or privilege of employment. So the key is that the accommodation is effective. What's reasonable will depend on what's feasible or plausible and won't cause a significant difficulty or expense to provide. And we know that this is called undue hardship. Of course, there can be various undue hardship issues that can crop up during this COVID-19 pandemic that maybe wouldn't have in the past. So it's something to be aware of. There are different ways to take a look at what creates an undue hardship. EEOC does give some good information on this in the What You Should Know document. Questions D9, 10, and 11 address some undue hardship issues that can come up. Also in the original guidance on reasonable accommodation and undue hardship, another great resource, they do sort of talk about undue hardship, not in the context of COVID, but again, another great resource for determining undue hardship and providing accommodations. Next slide. All right, so my objective there was to go ahead and sort of set the premise, the idea of providing accommodation and evaluating ADA-related situations and engaging in the interactive process to provide accommodations. So what I'd like to do for the second portion of the presentation is to talk a little bit about accommodation topics that have come up in the context of this COVID-19 related situation. Now, we know that a lot of the accommodations that are being requested now in response to COVID-19 are accommodations that might have been requested previously as well, but perhaps they were looked at a little bit differently than they are now. And so I'll talk a little bit about how maybe things are a little bit different related to COVID-19 and why somebody might need certain accommodations now when they didn't before. So let's move right into that. And I'm going to talk a little bit about, on the next slide, and I'm going to talk a little bit about various types of accommodations, but then also remote work accommodations as well. So it's sort of a hodgepodge of different accommodation topics that you might want to keep in mind. First of all, strategies for returning to work. We know that employers are trying to get people back into the workplace where they are able to and when it is safe to do so. There are strategies to reduce the risk of exposure to COVID-19 for employees who are returning to the workplace. Jan cannot say whether or not those strategies are adequate enough to keep people safe. What we can do is offer you strategies to consider and see whether or not you can implement them in an individualized situation. So as I mentioned earlier, you always want to think about everything on a case-by-case basis. We've put together sort of a resource that covers a lot of different topics around these strategies. You can access that on our COVID page. I've also linked it here. But basically, it talks about general solutions for limiting the risk of exposure. It talks about solutions related to addressing physical distancing needs, as well as addressing communication needs. Those seem to be the real issues that kind of come up. Next slide. So when you're limiting the risk of exposure to COVID-19, obviously you always want to take into consideration any guidance that's provided by the CDC, as well as the Occupational Safety and Health Administration and their guidance on how to prevent exposures in the work environment. It's important to post information from CDC regarding steps that can be taken to protect against the spread of COVID-19 and make sure you're implementing all those necessary requirements. It's important to ask that people stay home if they're exhibiting symptoms of illness and apply an attendance and leave policy as flexibly as possible. You don't want people coming to work ill. And so you want to ensure that they have the ability to stay home when they need to. So sometimes it might be, right now we're seeing some flexibilities in terms of attendance and leave policies so that people can be healthy and come to work healthy. So keep that in mind. You might need to request, provide, or allow employees to wear a mask or face covering in the work environment. Now, we know obviously that a lot of states have mandates at this point related to face coverings in public and in the work environment. Employers have the right to implement policies of that nature, and it's on the basis that they are trying to keep employees safe and reduce the possibility of direct threat. So it is okay to have those kinds of policies. You might need to make other types of accommodations when somebody needs a modification to that kind of policy, and I'll talk about that in a minute. It might be necessary to provide other types of personal protective equipment as well. So in some cases, it might mean a face shield or a gown or providing other things that would help to keep people safe. Next slide. Of course, anything you can do to limit the need to touch communal surfaces, try to do that. So automatic door openers, hands-free or foot pull door openers, touchless tools, faucets, waste receptacles. So anything you can do to stop people from touching commonly used surfaces, you want to do that. Posting signs reminding employees to wash their hands or use hand sanitizer when they cannot wash their hands. So in your restrooms, make sure that that's something that you have there. Cleaning and disinfecting public spaces frequently. So you want to step that up. So even though you might have cleaned before, now it's important to make sure also disinfecting those spaces regularly and providing cleaning and disinfecting products so that people can do that, especially when you might have surfaces that are shared or workstations that are shared, so people can wipe down those surfaces after each use. Providing effective ventilation for reducing the airborne concentration of COVID-19. This is where you need to get in touch with your HVAC people and make sure that your work environment is meeting those requirements related to air quality and what, increasing any measures that might be possible related to reduce the risk of transmission. Next slide. When you're looking at physical distancing needs, obviously you want to do everything you can to create physical distance between people. So you might want to establish policies and practices related to that, whether that's using signage around the work environment to keep people 6 feet apart when possible, marking the floors and public spaces, maybe using textured or highly visible tape and flow arrows to create single direction paths of travel, and creating limited or no access areas to keep people, only a certain number of people in a space at a time or not in a space at all. You could stagger or space out workstations and allow workers who have private workspace to close their door in order to, keep people apart as well. Next slide. More on physical distancing, installing a protective panel or shield or a curtain or other type of physical barrier. So for example, even providing a desk or a table between customer service windows, for example, to keep people just a little bit further apart. Limiting the number of people permitted in communal spaces at the same time. So, maybe not having more than a few people in one space at a time. Modifying schedules to limit the density of people in the workplace. We're doing that at JAN. So of course we were all sent home in order to work during the pandemic, but we are having to go into the workplace to do certain tasks. And when we're doing that, we're modifying people's schedules. So we only have a few people in the work environment in the morning, and then we shift and we have a few people in the work environment in the afternoon. So we're limiting the number of people there, when they're there, and what they're doing at that time. Next slide. More physical distancing, modifying a policy concerning where and when work is performed. Obviously, telework's the big thing there. So a lot of people are able to work remotely. It could be flexible work arrangements or alternative work locations. Some people can't work effectively from home, but there might be a different workspace that they can go to in order to do the work. Maybe an employer has multiple locations and they spread people out across those locations. Modifying work schedules and allowing telework to address COVID-19 related limitations in commuting to and from work. So whereas employers aren't required to get people to and from work, you might have to address some commuting related issues where someone maybe cannot use public transportation, for example. And of course, restructuring job duties to eliminate or reduce the frequency of the need to perform tasks that might require a mask or face-to-face contact with others. So if you're taking people out of the equation or limiting the number of people, it might be possible to not have to use those measures depending on the situation. Next slide. Now, communication is obviously an issue too, because people are not, face-to-face with each other necessarily. So you have to think about ways to communicate in other ways, whether it's with employees or customers or clients, maybe using remote methods, conducting group meetings and events using remote and virtual formats. Obviously, we're doing that today, and we've been doing that a lot since people have been sent home and not going to conferences anymore, for example. Using an accessible virtual meeting platform. So you want to ensure that that meeting platform is accessible to those individuals who might have sensory impairments, for example, and might need captioning, for example. So things that you want to keep that kind of thing in mind to ensure that people have access to that meeting using the platform that you've chosen. If you're going to have people who need to meet in groups, you have to limit that attendance for face-to-face meetings. Maybe hold those meetings and training in an open, well-ventilated space, or better yet, outside when it's possible. That's getting a little harder as it's getting cooler, but where it's possible. Next slide. Modifying training methods. So, we've had to, obviously people are still being hired and being onboarded during this time. So it might be necessary to train in different ways. I've had to onboard 3 new people since COVID hit and have had to really kind of change how we train people and engage people and stay in contact with people. So keep that in mind as you're training new people and people are learning new skills and information. Individuals who are in the work environment and where people are wearing face masks, if you have someone who might have a hearing impairment, they might rely on reading lips. And so masks can really cause an issue with that. And so it might be possible to use an alternative type of mask or a face shield when it's possible. It's not necessarily a replacement for a mask, but with distance, it might be suitable. But there are some face masks that are clear that are available, which might be able to be used in that situation. Or it might be possible to communicate through a video chat in different rooms where a mask doesn't need to be worn, or simply moving to text methods of communication. So keep those kinds of things in mind when you're thinking about communication. Next slide. Okay, so that's a lot, just sort of general strategies. These are a lot of things that can be implemented in many different work environments. I'm going to move to talk about masks and face coverings. So it's a big topic right now, obviously, but I think the bottom line here to keep in mind is that it is something that an employer can require in the work environment in order to protect people in the work environment, to protect employees as well as customers. And so, you are going to run into those situations where an employee says they can't wear a mask due to a disability related reason. When it is due to a disability related reason, the employer should engage in the interactive process and figure out whether it's possible to accommodate the individual through other methods. And that could include modifying the policy for a particular individual related to wearing a mask when there are other accommodations that would enable that person to work safely. Again, it's always going to come down to whether or not that person can perform the essential duties of that job safely with some other strategy in place. So a lot of the physical distancing type recommendations or suggestions that I mentioned earlier could be looked at given the situation. So again, very case by case. We do have a JAN article related to masks for COVID-19 management and ADA accommodations. So that's something you may want to take a look at. EEOC also talks about it a little bit in their What You Should Know guidance document. Next slide. Remote work and COVID-19. Wow, this is the topic, right? So lots of people are working from home. Is it something that should be considered as an accommodation under ADA? Well, we know a lot of employers sent people home, but now they're either returning to work or they didn't send people home and somebody needed to be at home for a disability related reason. So you've got to take a look at what's the situation. If it is somebody who's being asked to return to the workplace, they've been working from home effectively, the employer will need to look at whether or not they can continue to allow a telework arrangement as a form of accommodation. So you want to analyze that, go through that interactive process and decide if it's something that's reasonable. And if the person's been able to demonstrate they can perform those job duties effectively from home, that's going to be taken into consideration in deciding whether or not it's reasonable. Now, if essential job duties were removed for the purpose of getting everybody home, you really want to take a look at, can all of the essential functions be performed from home in order to enable that person to continue to work in that capacity? And so you have the right to take a look at that. If an employee received a workstation accommodation in the workplace pre-COVID, can they receive an accommodation at home? And EEOC is saying that, excuse me, if somebody was accommodated in the work environment but is being required to work from home or may need to work from home, employers may have to look at providing those types of accommodations at home, even though prior to COVID, it might not have been something that they had to consider as a form of reasonable accommodation. So it's one of those differences in terms of EEOC's opinion on how we look at COVID-19 related accommodations. Now, as far as it affecting future remote work as an accommodation, you might have somebody who maybe wanted to work from home previously prior to COVID, but they were told no. And now it might be something that an employer needs to consider, again, if it's reasonable. So keep all of that in mind. Next slide. And that's sort of what this talks about here, is just that idea that it's a complex issue. So accommodations at home prior to COVID were something that, as I mentioned, it might not have been something the EOC would have said was necessary to consider. But now with the current pandemic situation, it is something an employer wants to take a look at to decide if it's reasonable, if it will enable that person to perform the job duties. It's always going to come down to what's reasonable. And there can be undue hardship issues that come up in terms of the ability to access equipment right now. There's quite a shortage of equipment, so it might not be possible to get that. So there are undue hardship issues that can come up. Next slide. In looking at remote work considerations, you're also going to think about job restructuring. So maybe there were marginal job tasks that couldn't be performed from home. We know that an employer needs to remove marginal job tasks if that's necessary as a form of accommodation. So marginal, not essential. It could be restructuring when duties are performed. So maybe it's having that person perform the most difficult tasks during the time of the day that the employee is most, mentally aware in terms of their energy and their stamina, when they're most productive, when they're most available. So those things might need to be looked at. It could be providing ways to ensure that they're able to concentrate in the home environment, maybe providing a noise canceling headset or using apps for concentration. It's also about communicating in various ways to promote connection. That's something I think a lot of people are really having to think about right now, is making sure that people still feel and stay connected when they're working from home. So using various forms of communication, email, chat, telephone calls, using Zoom. I think the face-to-face connection, whether it's Zoom or any other virtual format, frankly, not just Zoom, but ensuring that people have a way to connect in sort of what's almost a face-to-face method, I think can be helpful for some people, particularly for people who really need that connection in order to feel productive and comfortable and like they're doing what they need to do. Designating uninterrupted time for tasks that require significant concentration, not requiring someone to answer emails during a certain hour of the day so that they can focus on things, or setting up specific days for meetings so you can plan for that and work around a specific day where you know those meetings are going to happen. Next slide. Flexibility is important when you're looking at remote work considerations as well. So it might mean considering a flexible work schedule, adjusting the start or finish time, the number of hours worked. Some people can find it easier to work during the very early morning hours or the late night hours to get all of their work done. So whereas that might not be the traditional 9 to 5 time, it may still be possible to provide that flexibility for somebody who is needing to work from home as a form of accommodation or otherwise. We have a lot of people who are working from home who, for example, might be working parents and they have their kids at home too. So can you offer the flexibility of them working during hours where they have the most availability? So it's something you could consider. Making sure that people take breaks, scheduled breaks to get up, move around. Even we've implemented coffee breaks, virtual coffee breaks at Jan once every week or two, where people can just get together for 30 minutes virtually and just connect, because you don't have those hallway conversations now, and so it's just a chance for people to just reconnect in a virtual way, and that can help everyone. Allowing time to be made up if someone's needing some flexibility and when they are working or when they need to be absent from work, maybe allowing them to make that time up because they know they can work at 10 o'clock at night, for example. Allowing access to leave. So there can be situations where somebody is dealing with sort of a flare-up of their impairment and they're finding that they're unable to work even in the home environment. So making sure that people have access to leave, even though they're working from home. Next slide. So in these, looking at remote work considerations, a lot of times ergonomics comes up. And so there may be some things that you want to think about in terms of ergonomics in the home environment. Obviously, people are going to be looking at sitting for long periods of time. And so you want to be thinking about ways to ensure that people can perform their job duties in a way that's safe for their health, and in terms of looking at ergonomics. That people need to ensure that their back is supported, their feet are grounded, their arms are supported, and that you have good posture. I can speak personally that I'm not very good at any of these things. And I think a lot of us can relate to that. You find that you're stuck at your desk and you're working hard all day long and you forget to get up and take a break and do what you need to do. So, but these are important things to keep in mind. Next slide. And in doing that, there are some accommodations, if you will, that you can consider. Lumbar support cushions to make sure that your posture is good and your back is supported, making sure that you have an appropriate ergonomic chair. Remember, I mentioned pre-COVID, that might not have been something an employer would need to consider providing. But in the context of this situation and working from home, if somebody had an ergonomic chair in the work environment, they might need it at home to continue doing their work if they're required to work from home. And it might be something that employers are just generally providing now because they've sent people home, and now it's going to be the way they operate. So a lot of employers are choosing to provide the equipment that people need in order to work safely at home. Adjustable height workstations, lots of requests for that. A footrest, making sure that your feet are supported in some way. Next slide. Get up and move. Avoid prolonged sitting when you can. Again, I mentioned I'm really bad at that, but it's something that's important to consider. So get up and walk around. If you're on the phone, and maybe take a break to walk around and talk instead of sitting at your desk. Use an alarm or some sort of notification to remind you to get up or change position in some way, whether it's going from sitting to standing every 30 minutes, that might help. Stretching when you can. There's a 20-20-20 rule. So for example, if you, for 20 seconds every 20 minutes, look 20 feet away. So take a break and look away from your computer monitor. So that there are things like easy, real simple solutions that people can implement on their own at home. Next slide. Difficulty using a notebook computer. A lot of people were sent home with just whatever equipment employers had. And so a lot of people were using notebook computers to do that. If it's possible, if you can use a full-size monitor, connect to that instead of using that tiny little monitor. Adjust the height, and there are different ways that you can do that. We get creative. I've used books, I've used baskets, I've used different things that I can use to get that computer at the height that I need it. Connecting to a keyboard or mouse can be a lot more useful than just using that little notebook computer too. So there might be things that you need to do to use that that notebook computer more effectively. Next slide. A docking station, forearm supports, be inventive. Like I mentioned in this picture, you can see someone using a box to lift that monitor up there. And you could do that and then use a keyboard directly with it, and that might help things work out a little bit better for you. Next slide. Difficulty keyboarding or mousing. There could be lots of things that can be done. Altering the placement of the keyboard or the mouse so that it suits you better. Keyboard height does allow for straight wrists, so you want to make sure that your wrists aren't bent. Consider different sizes of keyboards, different types of a mouse that you can use. So it may be a little bit of trial and error to see what's the right solution for the individual based on their limitations. Next slide. All right, more on keyboarding and mousing. There are a number of alternative keyboards that set up sort of a different positioning of the hands and a different mouse that you can use. Again, I'm still looking at trying to reduce what might be repetitive stress injuries that could occur from all of the work that we're doing at our desks. So there can be alternative ways of using that kind of equipment. An articulating keyboard tray would allow you to move the keyboard in an area that's more comfortable. A wrist rest, a forearm rest. There's kind of a silly example here of a loaf of bread, but there may be things that you can use like a tea towel or a pool noodle cut in half that would give you that sort of work at home accommodation of allowing you to have a wrist rest there. So sometimes we get a little creative at Jan. Next slide. Difficulty using a phone. So obviously if you're on the phone, you might have different equipment at home that you would in the office. So for example, in the office, I always had a wireless headset to use because I was on the phone all day long. Now I'm using a cell phone with earbuds so that I'm not, you don't have your neck cricked the whole time and you can relax your shoulders. So it might be necessary to use different types of equipment at home. So yeah, if you can get a hands-free headset, that's great. Certainly consider that. Earbuds, there is a phone holder so if for some reason you're using a standard landline phone, I don't know who has those anymore, but if for some reason you need to do that, it is something that you could put on a gooseneck phone holder if necessary. And of course, speakerphone, if you have the freedom to use that at home, you could certainly do that as well. Next slide. Difficulty reading documents, we're doing a lot of reading. Usually it's on maybe on a computer monitor, but it could also still be books or other types of print documents. So again, you want to stand up and move around, get in a different chair. Don't slouch when you're reading. Slant documents in a way that's comfortable for you. There are book or copy holders that can be used to kind of bring that up so your head's not down the whole time. If you have a cookbook holder, for example, you could go ahead and use something like that. So to get that copy up in a way that's more directly, the line of sight is a little bit better. Next slide. Eye strain. Of course, that's something that I think a lot of people are experiencing right now. You want to reposition the monitor, clean the monitor, reduce glare as best that you can. It might be possible to use a monitor riser to get that monitor up at a better height. Look at your task lighting so that if you need some additional light, that might help. Using shades or an anti-glare filter might help to reduce some of that as well. Some people use those blue light glasses as well, so that might be something to take a look at. Next slide. Okay, other things to consider: fatigue. Occasional changes in posture might be needed. Alternatives, sitting and standing, breaks to sort of recover from feeling fatigued, stretching. An adjustable work height station is a good way to do that. So you can alternate between sitting and standing. Some people use these little treadmill or bike workstations where you can kind of just pedal under your desk and kind of keep the blood flowing. Alarms and reminders to stretch, things like that. Next slide. Okay, so that was a lot related to working from home and considering ergonomics. Of course, you also want to consider other things like technology that might be needed to access equipment from home. So without just thinking about ergonomics, if we're thinking about products that people use to do their job, for example, somebody who might need software in order to access a computer system, like a screen reader or a screen magnifier, you want to make sure that employees have those tools they need in order to do the job remotely. Now, moving on, and we're going to finish up here in just a minute. Accommodation topics related to modifying a schedule. We're talking about workplace flexibility as a real big issue right now. Modifying a schedule, of course, is one of those flexibilities that a lot of people can take advantage of. And there can be many reasons why a modified schedule might be needed in the context of COVID. It could be for disability-related reasons, and it can be for other reasons too, if you're considering other workplace flexibilities. So, for example, again, if you have parents who are working from home and they have their children at home, if you have people who are taking care of others who might have limitations at this time and need some flexibility in their scheduling, you can look at that. But again, it also comes back to just making sure that people can do their work when they need to do their work. So lots of ways that you can modify schedules, whether it's adjusting arrival or departure times, setting up different shifts for people to limit the number of people in the work environment, allowing people to work part-time or reduce work schedules if for some reason they're not able to manage a full-time schedule right now for a reason related to COVID-19. Allowing people to take breaks and do what they need to do to keep themselves well at work. Altering when certain functions are performed. It could be changing a shift if that works out better for somebody who needs to work a night shift as opposed to a day shift. So lots of different ways that you can look at modifying a schedule as a form of accommodation and a flexibility to consider. Next slide. Okay, leave and COVID-19. I did just want to broach this topic briefly. It's one that I do a lot of talking about. We don't have a lot of time today to talk about it, but I just wanted to bring it up because, we have a lot of people who are being asked to return to the work environment now. And some of those individuals maybe were sent home and on leave. Or they might be individuals who were able to work from home for a temporary period of time, but now the employers recognize that is not something that's feasible for the long term. And so they want people to come back to work, but an individual for a reason related to COVID is not able to come into that work environment safely. And so if it is determined that an individual cannot return to the workplace safely without really, limiting that risk of exposure, and if they cannot telework as a form of accommodation, you can certainly look at leave as a form of accommodation under the ADA. Of course, you want to keep in mind any state or local mandates related to leave and sick leave that may have been implemented either for COVID-related reasons or otherwise, to determine if it's an option for them. But if nothing else is available, then certainly looking at it as a form of accommodation. the complexity in providing ADA leave in this case is that we're dealing with an indefinite leave situation. And we know that indefinite leave is generally not something that's considered reasonable under the ADA. Can employers provide it? Absolutely. You have that discretion. However, it is not something that's required. So it may be one of those cases that if somebody can be out for a short period of time and you're able to sustain that, then you could certainly grant it with an end date on it. I would say that I'm sort of encouraging employers not to consider providing leave with an absolute indefinite date. So meaning that you're not saying absolutely you can be out as long as you need to, or till a vaccine is available, or until COVID-19 goes away. And so, that's not realistic. So you really want to take a look at what's feasible at this moment. So maybe even not totally looking ahead to the future, but what's feasible at this very moment. So you could grant it for a period of time and then reevaluate and decide what still continues to be reasonable given the situation. Next slide. Whew, that was a lot of information. So hopefully you found it to be useful, and hopefully you'll turn to it even as you follow up on this training. The next several slides, I do refer to a number of resources that I did speak of in the presentation so that you have access to those links and that information. Like the accommodation strategies, coronavirus related information related to masks and stress and mental health related situations. Next slide. Also referencing information related to engaging in the interactive process and managing reasonable accommodation requests related to COVID-19. Next slide. And of course, there are also resources just that are not COVID-19 specific from the JAN website that you might find useful. So that's what you see here related to engaging in the interactive process and providing temporary accommodations and sample forms that we have available that you can customize. Next slide. And then, of course, finally, EEOC resources that I've mentioned today. There are a number that I think are really great go-to resources. We use it to provide the guidance that we provide to everyone. So I'd encourage you to make these some go-to resources for you as well. Next slide. Well, that's the end of my talk, and I'm happy to open the floor up to any questions that everyone has at this time.
Yeah, thank you, Tracy. I'm just going to continue to keep the slide up just for those of you who are interested in having access to Tracy's information. Great information, Tracy. Just a couple of quick reminders before we get into the question and answers. Again, for those of you who require CRC, CESP, SHRM, or HRCI, or a certificate of attendance, be sure to select the link that's available in the chat box to complete the form, just to verify that you've participated in today's training. Also, there is an evaluation survey link just to evaluate today's training, and that will also be available in the chat box. So again, if you have a question and haven't had an opportunity to ask that, please feel free to use the chat box. So with that, I am going to turn it over to Vicki Nelson, who has been monitoring the chat, and just go through some questions. So Vicki, I'm going to turn it over to you.
Okay, well, thank you, Tracy, and thank you, Kim. At this time, there have been no questions. So I guess I would like to reopen it for anyone to ask a question. And Dan Simon just said, I have a question. Okay, Dan, do you want to type in your question, or would you like to just unmute and ask that question?
Can you hear me?
Yes, we can.
All right. Hi, Vicki. Hi, Tracy. How are you?
Hello.
First of all, this is a very informative class, so I really appreciate it. My question is one of the slides mentioned that you might have an employee that comes in, and let's say your office has a mask mandate. But an employee comes in and says, you know what, I have a condition, I can't wear a mask. So obviously, probably the first thing you need to do is get some sort of documentation, but let's be honest, I don't deal with ADA very often. And it probably wouldn't be a stretch to get a doctor to say, oh, so you're sitting in a cubicle, you're kind of socially distant. Yeah, I'll write you a note that says that the mask, you know, makes you not breathe well or whatever. How far can you go in requiring more documentation or enough documentation that really solidifies that the person cannot wear a mask rather than they feel it's more of an inconvenience?
Thank you, Daniel. That's an excellent question. I'm glad you brought it up because it did give me the opportunity to expand on that issue a little bit more. So, you know, we know that people are going to come into the workplace and you're going to have people who are not happy about wearing a mask, and you're going to have people who may not be able to wear a mask. You also might have other reasons why someone might not be able to wear a mask that might not fall under the ADA. We'll focus on ADA, okay? So if you have an individual who comes in and says for a medical reason that they have difficulty or are unable to wear a face covering, a mask of some kind, then yeah, the duty at that point is to engage in the interactive process to gather some information to figure out, do we have somebody who has the right to receive a possible accommodation if there's one that's reasonable? From a federal ADA standpoint, that allows the employer, assuming that the impairment and the need for the accommodation is not obvious, and in most cases, I would say it probably will be in those situations, the employer has the right to yes, request some documentation from a healthcare provider. What does that look like? Well, it looks very much the same as any other request for accommodation, meaning that the person should be able to establish that there is an impairment that affects the person's ability to wear a mask for, you know, some sort of limitation related reason. So you're looking for a healthcare provider or some other appropriate professional. It might not be an MD, for example, or an NP or a PA. It could be a counselor, a therapist, someone else as well. So you're going to be looking for information that establishes what that impairment is, why it affects their ability to wear a mask, and why they need an accommodation in the work environment. So you're looking for sufficient information to establish an ADA right to request an accommodation and receive an accommodation if it's reasonable. There are different ways you can go about doing that. It could just be using your own forms if you have them for requesting that kind of documentation in any other reasonable accommodation situation. It could be asking the individual to get a note from their provider. Yes, you're right. You know, a lot of people can go to their provider and say, hey, can you just write me a note so I don't have to wear a mask? And some providers will do that. Some will not. So, you know, right. So I think it's important to know what information you need to establish this as an ADA related situation. Now I'm going to veer off a little bit from ADA for just a second, because what we also know is that in some states where there are state or local mandates related to wearing a face covering, some states have implemented restrictions on the kind of information that can be asked when someone says they can't wear a mask. Now, some of those restrictions only apply in the public context. So for example, if you go into a retail establishment and you say, I can't wear a mask for a medical reason, that retail establishment isn't allowed to ask questions about that. And I would say probably more of those mandates have addressed that issue. Some mandates we have found, and I cannot name them specifically right now, but some mandates have put some little caveat in there that says that employers can't even ask that information. And unfortunately, because that provides broader protection to the individual, it will supersede any ADA guidance. So I think the first thing you need to do is be aware in South Dakota what the requirements are if there's a mandate, and how it applies to an employer's ability to request information. If there is no such restriction or related to that, then you're going to follow the ADA rules related to obtaining that information. So the bottom line is, know what the state or local mandate allows. Follow your interactive process, look at it from an ADA standpoint, obtain enough information to understand what the impairment is, what the limitations are, and how they affect that person in wearing a face covering, and then look at whether or not they can be accommodated. Some people think that they can just say, I can't wear a mask, and they can still do their job. That's not always going to be the case. So, I think it's important to then take a look at, are there other reasonable accommodations besides wearing a face covering of some sort that would still enable the person to work safely? Maybe that's working from home. Maybe that's working in an isolated environment. But you just got to do your due diligence in going through that process.
Okay, thank you.
You're welcome.
And we have 3 more questions up right now, Tracy. This question is from Melissa Hall. How can you find a medical provider that is proficient in the ADA process when needed? And then this one might be somewhat related to the medical provider by Karen DeLang. How much time should you give the medical provider to respond? What recourse does the employer have if they don't receive the information? So that's a little bit about a medical provider and finding one that is proficient in ADA. And then also then when you are looking for a note from a medical provider, is there a certain time that an employer would need to hold off or wait?
All right, all excellent questions. I love your questions. So first of all, in terms of finding a medical provider who's proficient in ADA, it's tricky. We know that, healthcare providers are not necessarily educated on the ADA or the reasonable accommodation process. And to be honest, they don't need to be necessarily. They're there to support their patient. And so what they need to know is, how can I support my patient's request for accommodation? So if I'm talking to an individual and their healthcare provider, it's about helping that healthcare provider provide the information needed so that the employer can establish whether or not that person has a disability. Keep in mind, it is not the healthcare provider's duty to say the person has an ADA disability. Their job is to provide documentation to support that decision-making process. So again, you're looking for impairment, limitations, impact on performing job duties. So that's the kind of information you are looking to get from the individual through their healthcare provider. Now, that being said, it's important for you to know what you're looking for. So if you're going to ask someone to provide you with information, tell them what you need. Have a form that asks for certain information. Be careful not to ask for information you already have. So if you have a form, you might need to cross things out if you know certain things already, because that can be a violation of the ADA. So know what you need in order to go through that interactive process to decide whether someone has a disability and to decide what accommodations can be provided. With respect to the question on a time frame, under the ADA, you may be aware that there's very little that's black and white, and there are no timeframes for just about anything. So what that means is that an employer does have the discretion to say, please return this information to me within X period of time. Because there's nothing standard under the ADA, we typically suggest you consider up to 15 days. And simply, it's arbitrary. It's consistent with other laws like the Federal Family and Medical Leave Act, which does require that employers allow up to 15 days. So do you have to use that? You don't. Is it something that just keeps things consistent? Absolutely. If someone doesn't return it in that time frame, does that mean everything stops? Not necessarily. What I would suggest is remind the individual what you need, that if it's not provided to you, you won't be able to accommodate them. So encourage them to understand the importance of providing that information. We do have a Jan blog related to addressing these types of time frame issues. It's called Avoiding the Waiting Place. And so that would be a good resource for those people who are looking for more on that topic. So again, a Jan blog, Avoiding the Waiting Place.
Okay, we have another question, and this one comes from Angie Nath. How do you determine if an accommodation is unreasonable in terms of cost, as every business will be different?
Another good question, and that's a tough one. So pre-COVID, we would always say to employers, be real careful trying to use cost in order to determine undue hardship. In doing that, you're asking the EEOC to come in and take a look at where you spend all of your money. Undue hardship is a high threshold. It is one that really truly is a defense for when you just cannot provide an accommodation. Using cost is tricky because you're forced to take a look at the overall cost in comparison to the overall, financial resources available to that employer. So I would encourage most employers to avoid cost at all costs when you're looking at establishing undue hardship. If there are other things that you can take into consideration, you would do that. So what sort of significant difficulty is there in providing the accommodation? Is it that you're unable to obtain the equipment or the resources needed to provide the accommodation? Is it that it isn't possible because it causes a significant disruption to the operation of the business in some way? So I would encourage you to look at other means for establishing undue hardship. In a lot of situations, it's just not really going to be something you're able to do. Now, I will say leave is probably one of those scenarios where it's probably easiest to establish undue hardship because the employer truly can identify the specific impact on somebody not being available to work. And I typically encourage employers to document that impact, not as a way to penalize the individual, but so that you can make a factual assessment as to how that person's absence has affected the operation of the business or the work that people get done. So, so that, I would say when it comes to undue hardship, that's probably one of those areas where it's easiest to do. And you might even be able to demonstrate a cost issue there too. But otherwise, I'd probably discourage you from going that route.
Okay.
Oh, just one more note on that. I'm sorry, Vicki. One thing I did think of, and you'll see it in the what you should know guidance, particularly right now with the COVID related situation, a lot of businesses are not operating at the level they were previously. And so their financial resources would be very different right now. So in those situations, you might be able to establish that the cost of providing something might not work for you because of the significant financial impact on the business related to COVID-19.
Great. At this time, I don't see that there are any other questions. I guess I'll just put out a call for any other questions. Chat box is quiet, so that will be all the questions, Tracy. Thank you so much.
Wonderful. Thank you.
Mm-hmm.
Thank you for your assistance, Vicki. And again, thank you, Tracy, for your wonderful answers to those wonderful questions that were asked. So with that, thank you everyone for participating. And again, a huge thank you to Tracy. The information you shared with us is very valuable. We appreciate you all being here today, and thanks again for joining us. So that wraps up today's training.
Thank you so much for inviting us to provide the training. Appreciate it. Everyone take care.